Hi there, I'm Hussain Gandhi. I'm the CEO and Managing Director of Aafiyat Medical Centre. Today we have.
Fatima Patranwala. I'm a homeopath. I've been practicing here since like 1 year now in Aafiyat. I've been in Canada for the last 7 years, but I joined Aafiyat team in 2022 and it's been great.
So tell me a little bit about your journey. What got you interested into homeopathy? Tell me everything right from the beginning.
Well, this take goes back to 1991 when I was born.
Oh, so you've given everyone your age now. You look a lot
Well,
younger than 1991, but all right, okay, I'm not saying anything.
so like everybody, most people don't know about homeopathy, and I think back in 90s and it wasn't that famous. Now it's got track on, but it wasn't that famous. So my mom dad didn't know about it. My mother has been an asthmatic all her life, and she had taken every treatment under the
So
sun.
let me understand. You were in Bombay, right? Or
Yes,
Mumbai it is
Mumbai.
called.
I was
Mumbai.
in Mumbai,
Okay.
Bombay back then, Mumbai right now. So she had taken every medication under the sun. She was on steroidal medications, on puffers, everything. She was doing everything and she was surviving all this while. She had it, I think, since middle school, right? But when I was born, she got a very bad flare up and I was born as well with asthma. So I was a newborn, I was in NICU. It was a very difficult journey for my whole family. And my mother was almost like on her deathbed. Like, she couldn't even cross this much without being breathless. Like, she was just not having it. And my father was very helpless and was very desperate to try everything that is going to make a difference to his family, right? And I was the firstborn in his for my mom and dad. So somebody told him, some well-wisher told him, hey, you've tried everything, tried homeopathy. So he said, okay, I'll try homeopathy. And he went to see a homeopath. Both my mother and I were treated under him for good 1 year, 2 years. And I'm here today. I am, as you say, I've given my age, I'm 32, and I haven't had a single asthmatic episode my entire life after that first year I was being treated with
Wow.
homeopathy. That's so I have been an avid hiker, trekker. I've gone to altitudes with no issues with breathing. Everything is okay. And even as a child, I didn't have it. It was just that first year I was rigorously treated with homeopathy, and then I was no turning back. But for my mom, it was even better because she had half her life been on, all these medications. And today, she does not take puffers on a regular basis. She only takes a puffer when she's doing a strenuous activity like going for a hike or a trek or something like that. She's absolutely living her normal life to a fullest extent with no medications to depend on.
So homeopathy has changed your entire family's life,
Yes.
or perhaps you can say that your family's life kind of depended on homeopathy,
Yes, and then we
right?
didn't have a normal family doctor. We had a homeopath who was a family doctor.
Ah,
So
okay.
all my life I've gone to a homeopath to see whether I had dengue as a child, chickenpox as a child, malaria as a child. These are common ailments you get in back in India,
Right.
right? So all of these, I've never taken any antibiotic, only treated exclusively. I'm a homeopathy baby.
That's nice to know that. It's nice to know that you can actually live your entire
Like
life
just on
just
homeopathy.
on homeopathy. What about things like vaccinations and things like
We'll
that?
have done all of that.
We've done all of
We've
that.
done
Okay,
all
so
of that.
the standard, what is
Yes,
expected
yes,
is
yes.
you done. What is actually homeopathy for somebody? Imagine I'm a 5 year old. Explain it to me as if I'm five. What is homeopathy?
Well, that's going to be difficult. You need to increase
Okay,
your
let's
age.
10 years. Okay,
Let
I'm
it
10
be
years old.
teenage. I
Okay,
can relate
teenager.
to a
All
teenager.
right, let's go with a teenager, you know. I'm a teenager. How would you explain homeopathy
So if I
to a
have to tell you a
teenager?
story, well, it goes back to this doctor who was very frustrated with the medical system at that time in Germany, and he said that there has to be some better way to treat people. This can be the thing. So he was going through some sort of research papers, and he found out upon this. I'm telling the story of how homeopathy was born, right?
Correct.
So he found out upon that this bark exclusively was used by tribal people for, like, you have home remedies, like people have been passed on these remedies from their generations, have been treating to treat certain ailments. And he said that this bark is used by this tribe. We're talking about Cinchona. It's a
And the tribe is in Germany, or where was this tribe?
it was native to that land. It was
Okay.
native to that land. And he said that, okay, they are using this thing to treat malarial fevers.
Okay.
Right? There has to be something with it, right? So then he started experimenting on himself, on his peers, everybody. And then he found out that when you take little amount, so if you take it in crude form, like you take lots of it, then it kind of gets uncontrolled behavior, uncontrolled symptoms for that person. But he started reducing the amount, and he realized that when given in reduced amount, it kind of cures similar symptoms in a person. So he kind of then went into extensive study. So if you
So
know
no,
Hippocrates,
let me understand this. So when we're talking about malaria, he actually
treated,
treated malaria by introducing malaria.
no, by
So
introducing small amounts of that bark,
that bark.
the bark
Okay.
of the tree.
Okay.
So if I'll tell you how, then he found out what is this thing, like how is this possible? So then
Right.
he did further study, and he went back to 400 BC, when we call the father of medicine, which is Hippocrates. We
Okay.
take a Hippocratic oath,
Right.
right?
All
After that,
doctors
all
do that.
doctors do, right?
Right.
Everybody knows who Hippocrates is.
Right.
So he had said that like cures like. That's where homeopathy comes from. So if you take a substance that's formed in nature and it creates a similar disease state, like say for example, I give you a common example of allium cepa. That's an onion remedy which is used very primarily for allergic symptoms. When you get allergic episode, what are the symptoms do you get? Runny nose,
Right.
puffy eyes, watering from the eyes, congestion of the
Right.
nose. Your face gets all red and stuff. If you give allium cepa, and for example, okay, leave that. If you're cutting an onion, what's the state that you're getting?
I
Similar
cry.
state.
Yeah, a similar state.
State.
Exactly.
You take onion,
All right.
give it in small quantities to the patient, you're curing allergy for him. It's a
Okay.
very common remedy that is used to treat allergic symptoms in patients.
So let me understand it right. So there are substances in nature which would cause you the same reaction as if you had that disease.
Yes.
And you take those substances in small nature, your body gets adapted, or I do not know what happens within your body, but then your body is ready to fight anything which is bigger, which would cause some similar symptoms, and be able to cure you. Is
So
that
I'll tell you what happens is when you have a disease, it's uncontrolled, right? Those symptoms are uncontrolled. But the medicine that you're giving is in controlled form. So you're giving enough, so like cures like. So you're giving that enough amount of that potent substance in your body to fight that thing
okay?
and overcome that thing. And
Okay.
once it overcomes that thing, you stop giving the medicine.
Right.
So you don't have either the disease nor the medicine in your body.
Okay.
So it cancels out each other.
Are there any homeopathic preventative medicines available, or they're all for cures?
So we talk about immunity boosters, that what is layman language, what it's called, where we have children who are falling sick too often, we kind of give. So these are different kind of remedies that are catered to chronic or lifestyle circumstances or lifestyle makeup of that person. So we study as to how that child is. Is the child too irritable? Is the child too hyper? Is the child, lazy? Or is the child, obese or something like that? We understand the personality makeup. Then we match that with the symptoms that we're finding in a remedy, and we create a balance. Because how do you fall sick? When you are stressed out, either physically, emotionally, you're stressed out in some way. Children are same, okay? They are stressed out in some other way. Either there is the environmental chaos going in the family, or they are being, exposed to certain things that they are not favorable to, and you fall sick, or environmental changes, right? So if you have, it's either too cold or too hot, and your body suffers. So it's creating a state, right? It's a stressful state. So we match We study that state in all aspects. So when I'm, talking to a patient, I will study his physical symptoms, his psychological symptoms, how is it affecting him emotionally, how is it changing his life, his routine, and everything. And depending on how he feels, we match all of those symptoms to a remedy. And I'll tell you how the remedies are studied. These remedies, every single remedy in homeopathy is exclusively and extensively studied, one single remedy at a time. And we have so much data on it. Like, there have been books and books written, there have been so many softwares. Now we use softwares, we don't use books. I have a software where I'll just look upon and I'll have like 1,000 different, studies on a single remedy, right? And they have been studied from every aspect. So you take a remedy, you give it to a healthy individual. This is how provings are done, right? You're giving double blind method, cross method. Giving that remedy, you're studying that whole individual, not just the single part of it.
So this is all a scientific based approach.
Yes.
So unlike what some people hear in the media, homeopathy is based on real science, right?
Absolutely. There
Okay.
has been so much of research. Like, it was introduced in 1755. This German doctor, he introduced it. And since then, you won't believe, this is the second largest medicine approach that has been used since the last 200 years. Like, it
Wow.
has been used in the whole of Asia, the whole of Europe, the whole of, I mean, like, even North America, right? America was, they had almost 35 hospitals in America back in 1900s. But when the whole pharma boom came, they all had to shut down.
So perhaps it must be something related to the money and the amount of money which is spent in the
Well,
pharma
definitely,
industry.
all of these remedies are plant sources, mineral sources. There's
Right.
nothing like you are spending millions of money to produce them. They're freely available in the nature, so there's
Okay.
no money. So everything has a business aspect, I feel.
Maybe let's not go into that, the business aspect, but we understand that homeopathy is rooted in science and it does not cost a lot for those remedies. Another thing which I understood when I talked to you is that there isn't one size fits all.
Absolutely.
uh, every individual person's needs will need to be tailored to. You can't have, okay, for your well-being take this, for it will have to, you'd have to understand the patient. Is
So,
that
for
correct?
example, you have a headache, I have a headache. I'm going to give you a completely different remedy than I give myself, because I am experiencing this headache in a different way than
Right.
you are experiencing. The whole state of you, you can think of so many things when you are having a headache. Oh, I'm irritable. I don't want to sit. I want to walk. But as I want to sit and I don't want to walk.
Okay.
It's a different state,
Right.
right? Everybody has a different way of experiencing a certain symptom. So we study all of that, and based on that, we give a very a very customized remedy just for that person. So there's a lot of options available. There's another question a lot of patients ask me, oh, if this doesn't work, what is going to work for me? Am I not going to get a remedy? I'm like, don't worry, it's okay that this medicine is not suitable to you, but there are so many other remedies that can be helped for this particular condition.
This brings up an important question, because I have seen in certain um, drugstores over the counter homeopathic medicines. So have you seen those?
Yes.
I think based on what you're telling me, that's a definite no-go zone, because, right?
50-50. There's certain things, like for example, I said allium cepa, right? It creates such a strong state of that, all those puffiness, congestion, and it acts on your upper respiratory tract, that you can use that as a over-the-counter drug for any allergic purposes, and it will have an effect. But if you're talking about major illnesses, chronic illnesses, where your whole state is different, you're experiencing that particular thing in a different way than a different person is, in that case the customization comes. So not all illnesses can be treated over the counter.
I would look at it from a layman perspective. I would I would say go visit a homeopath to
Yes.
understand whether you could take any over the counter
I'll
also, right?
rephrase it. If you
Right.
have something one off and you want to see that, if somebody's recommended you that and it really works, then you can try it out over the counter. But if you don't know anything about it and you have no idea what it is, then you better visit a professional because they are going to
Right.
be likely to help you more efficiently than you buying something over the counter.
So, can you share with us a case study which you think the audience will actually like? Something, of course, your entire life is a big case study itself. There
Yeah.
cannot be anything bigger than that. But something with your patients, and of course, we'll respect the patient's confidentiality. So, something which they tried and you were able to help them.
I can talk to you about my first case in Canada.
Okay, let's do that.
It was special to me,
All right.
and it has been special till today because I kind of got attached to it in terms of how that person got better with homeopathy. It was a very beautiful journey for her. So this was a young girl, a desperate mother who comes to me. She has been given a diagnosis of lupus, systemic lupus erythematosus, and the child is just 10 years old. And she's like, I've never heard of this. I don't know what to do with this, what to make of it. And they've told that she has to stay on these drugs her whole life. And she was very desperate. She's like, I don't want my child to be. And she did a lot of studies and all of that. And it's a life limiting disorder, right? It kind of reduces your life expectancy as well as you progress towards the years, even though you're on those drugs. So she had been seen by the doctors, given a treatment, everything done that, and the child was okay, but she still had few symptoms. I saw her. So my first case, it was somebody referred it to, so referred
And this was how long ago?
7 years ago, because
7 years ago.
this
Okay,
was my
so
first case in Canada. When I
okay,
just moved here, I had not built up my practice. I
right.
saw her at my own residence
Okay,
because it was somebody close to me referred
right.
her.
Okay,
So I said, okay, I'll take up on this. Okay,
okay,
and this was me not doing anything at that moment. I
right.
was still trying to set up my practice. So this girl comes to me. I saw her. I took her entire case. I studied her entire case. I started her on treatment, and I saw her for good 2 years. So it's not like she was just took the medicine and miracle and she's gone. And she was still continuing all those drugs while on the at the same time,
Oh, so
right?
you can actually continue your
Yes,
allopathic
I do
medicine,
not
right?
like. I do not tell my patients to stop any of the medical drugs that they
Okay,
are on. It's the prerogative of the doctor who has put them on. So once they start feeling better, they can have a discussion and sit down with their own doctor and say that, hey, I want to get off this medication.
right.
I don't say that. It's not my prerogative. So she was taking all those drugs, and 2 years we had, continuous treatment, and the child is fine. She has been not having a single flare up with her lupus all this time. She's not on any drugs. She's not on my medication. She's not on any of the other drugs as well, and she's living her life to the fullest.
And she's 17 years old now, I'm
Yes,
guessing, right?
yes.
You still see her from time to
The
time?
mother keeps updating me. Like she sometimes falls sick, then she's having like a little runny nose. She'll give me a call. So I'm
Okay,
still an on call, on and off. Stay in
right.
touch with that. But for her, this condition, she's rid of it.
I am so glad. I'm so happy for her, and
This
I'm
was a lifelong disorder, which the doctor told her that you have to take this all your life.
okay. So now I want to ask a few questions here. I want to ask about how can one become an homeopath? You have your qualifications from India, and then of course, how do you get certified in Canada? But before that, I want to ask you, what are a few conditions which you think homeopathy would be the best approach for?
Well, these days I see a lot of patients with gastrointestinal disorders. Like it has become a lifestyle issue for people having reflux, ulcers, or maybe colitis, ulcerative colitis, or maybe like IBS. There's a lot of all these symptoms and syndromes that are coming up in the gastrointestinal tract, and I have seen good results. Like with elderlies, again, they are desperate because they've been told you have to take this omeprazole or Dexilent all your life. Like they don't want to, and at the same time, they're not even rid of that symptoms. The people do have acid reflux even after taking those drugs, because the drug dependency just kind of, at a certain point the drug stops even, working from them. You increase the dose, you keep increasing the dose, and the doctor says that's the highest I can go, you cannot go any higher than that, and you still have those symptoms. What do you do after that? So
Okay.
I am still, I currently I am seeing this elderly woman who has acid reflux for the last 20, 30 years, and she was on all these drugs, and now she doesn't have it. She's in since like 1 year, and now we've gone to a point that she was taking 4 omeprazoles a day, and now she's taking one every 2 days. She still is dependent on it for
Right.
some extent, but she's has no symptom. She's been on medication, and I'm now trying to wean her off my medicine as well.
Okay.
So when somebody comes to me, there's no drug dependency on homeopathy. That's the basic plus point, that we do not keep patients on drugs lifelong. Like you come to me, I treat you, boom, they're gone, bye bye. You can come to me for some other reasons, but you're not going to come to me for the
For
same
that
reason.
same reason. So one set of conditions are the gut conditions. What else do you think?
Well, asthma, you have my
Yes,
life
of course,
history.
asthma.
Upper respiratory tract diseases.
What about for things like cholesterol and things like that? Or
Absolutely, absolutely. But for those things, there is a lot of strong impact on your lifestyle disorders. So if somebody comes to me and they're not ready to change their lifestyle, I'm saying my drug is not a miracle.
all right.
You can't take a pill and say that my cholesterol is going to go away. So if someone wants to do that, there are different modalities that needs to be taken. Homeopathy is not exclusively on that.
Okay, so now before I ask you about the education question, I want to know from in Canada, healthcare to a large extent is covered by Ontario Health, or in Ontario it's covered by the OHIP, but it's basically taken care of by the government. Homeopathy is not. Do extended healthcare cover it?
A lot of my patients, yes, they need to figure out what's included in their plan. It's not, there's lack of awareness of homeopathy, right? So
Okay.
then there are certain companies who include homeopathy as part of their program, and then the patients have that coverage. So I would say the ratio for my practice would be 40-60. Like 40% of them are somewhat covered by their insurance companies, private extended insurance. So it's there. It's all you need to do is ask, or
Correct.
maybe include it in your program if you can. Like certain things that if you're going to use it, you might as well
Might as
have
well
it in
include it.
have it in your
So
plans.
let's say 60% of the people they do not, right? And let's take this particular case, the elderly person who had gut health issues. How much would it have cost her over a period of 1 year, to see you for that particular problem?
See, for when I charge my clients for my consultation. Medicine charges are just $10.
Okay,
So if I'm giving you something and you're feeling better,
right,
I don't need to see you. I just need to refill that particular thing.
right.
It's going to charge you $10 a month.
That's it?
Yes.
Okay, so just one time consultation and then $10 a month,
One
more or
time
less?
consultation, more or less. If I need to see you, then I'll
Right.
charge you for my consultation, because I'm
Okay.
sitting and then kind of understanding what I need to change in this. So then I'll charge you for my consultation. But
Right.
other than that, if you going good on that medicine, I have no issues seeing you, and I'll just give you a refill, and that's going to cost you 10, $15.
You know what I thought? I thought you'd have to see the homeopath every month for your
It
refills.
depends, like if you
So,
need that support,
right,
right? If
but
you don't need that support, like initially I see my patients on a monthly basis till their treatment comes on track.
okay,
Then we both comfortable with it. Then I do tell them that I don't need to see you for the next 2 months. You can
perfect.
have this. That's all. You can, if this gets done, like you can do a refill, and that's about it.
So it works, it does not cost a lot of money out of pocket, and the drugs are $10 $15 per month, which is like nothing compared to what other drugs might actually be. Now, tell me, how does one become an homeopath? And are there different specializations in homeopathy? Tell me the entire educational journey.
So I have done my schooling from India, and in India, it is as the education is as far as somebody who becomes an MBBS.
Okay,
Right? We
that
have
is
this, we study the same
right.
subjects.
Okay.
The only difference is the pharmacology part. We study homeopathy pharmacology, and they study the conventional medicine
So
part.
it's a 4 or 5 year program?
5.5 years.
5.5 year program
Yes.
and you get to be called a doctor in India, correct?
Yes, it's a bachelor's degree. Then you get
Okay.
to be a doctor. There's a 3-year master's degree. If you want to specialize in a certain field, then you can do that as well. There are two different ones: theory and as well as clinical. So there are a lot of MDs who have done their masters in pediatric. They've
Right.
done psychology. They've done in dermatology.
So psychology also can be a part of homeopathy?
Well, like I said, we
Yeah.
study the whole state of the person. So a lot of
Right.
my patients said, "You are a psychologist or a homeopathy," but that's how we've learned. Taking case from for a
Right.
person, that we study everything about that person. How is it affecting him? What is he thinking? I'm not going to give you advice as to what needs to be done. I'm not a psychologist, but I'll understand what you're feeling,
Okay.
and my understanding will be beneficial for you, because then I'm selecting the right drug for you.
Perfect. Okay, so I think I've covered most of the questions which I actually had. Um, is there any question which you think I have not asked and you think the audience need to know?
Well, I would, if you want to end it, I would say that homeopathy is not the answer for everything,
Okay.
right? I would just say that it is a beautiful adjunct to your existing mainstream medicine. Like it works. It can work with your conventional drugs, and right now we are in in an era that we don't have simple ailments. We have complex ailments. Like, nobody is just having a problem with the liver. Everybody is having multiple issues. So you can't have a pill for every ailment. You need to have a much more comprehensive and holistic way. And homeopathy is one thing that is going to help you with that. Yes, the other medicines are life-saving drugs, and they are important to you. But if you have another way of making your life better and not depending on that drug for your whole life, like, I think that's like a major plus point with homeopathy. And I personally feel that if somebody is being, dependent on that drug the whole life, it's limiting their experience, right? They can't live their life to their fullest. So if there is a way that you can get back to that strength and that health by not being dependent on drugs, why not choose it?
So let me put a little self promotion out here. We run Aafiyat Medical Centre, so we have the medical, the conventional medical aspect of it, and then of course we have you. We besides that we have a naturopathic doctor who comes in. So it's up to the patient to actually decide what kind of a treatment plan resonates. We provide everything on a platter, and then the patient can actually decide which direction they actually want to go into. And whatever works for the patients, we out here to support that. Because after all, we want to guide you into Afiyat, we want to guide you into a state of well-being. Thank you so much for joining me today. It was such a pleasure talking to you.
Thank you so much, Hussein, for having me. Thank you.